Hi, this is Dr. Fox. Let's talk about the pharynx. In this video, we'll discuss the pharynx, or the throat, and the subdivisions of the pharynx, including the nasopharynx, oropharynx, and laryngopharynx, and discuss any of the major contents of those spaces and how materials travel among those spaces. We'll also discuss the muscular wall of the pharynx and how it's innervated by the pharyngeal plexus. So the pharynx is the common pathway for the respiratory and digestive systems. So as such, it is continuous with the nasal cavity and the oral cavity. The nasal cavity is a dedicated pathway for the respiratory system, whereas the oral cavity is also part of this aerodigestive pathway. Distal, or beyond the pharynx, is where we have these spaces divide and allocate to specific systems. So for instance, we have the larynx, or voice box, which is the most proximal dedicated part of the respiratory pathway, distal to the pharynx, and the esophagus, or the tube that connects the pharynx to the stomach, being the dedicated pathway for the digestive system. The pharynx has three distinct subcomponents: the nasopharynx, the oropharynx, and the laryngopharynx, sometimes referred to as the hypopharynx. So let's take a look at these subdivisions and where they're located. So immediately posterior to the nasal cavity, we have the nasopharynx. The nasal cavity and nasopharynx are separated by the choani. These are the internal nostrils, or nares. And this nasopharynx extends distally to the plane of the soft palate. So if we draw a line through the soft palate, roughly posteriorly, we are able to prescribe the nasopharynx. At this point, we're in the oropharynx. The oropharynx is contiguous with the oral cavity at what is known as the palatoglossal arch. And it transitions between the oral pharynx and the laryngopharynx at the pharyngoepiglottic fold and the epiglottis. So that's going to roughly run through here. We'll see this in a better view posteriorly in a second. The laryngopharynx then would continue on to the laryngeal inlet and down to the inferior margin of the cricoid, which is going to divide the laryngopharynx from the esophagus. And that's approximately at the level of the sixth cervical vertebrae. Now let's take a look at some of the contents of these subdivisions. So within the nasopharynx, there are a couple of major features that we'll see, discuss, and look at in greater detail in subsequent sessions. So let's start with the pharyngeal tonsil. The pharyngeal tonsil, or the adenoid, is located in the superior surface or wall of the nasopharynx. So this is a collection of lymphatic tissue that materials that travel through this space may be brought into contact with. There is also the opening for the pharyngotympanic tube, also known as the eustachian tube, which is going to connect the nasopharynx with the middle ear so as to equilibrate pressure within the middle ear. So if your ears have popped, you know that's air traveling through that pharyngotympanic tube, or eustachian tube. And surrounding the opening of the pharyngotympanic tube is a collection of other lymphatic tissue known as tubal tonsils. Oropharynx is a little more complex a space. So its going to be contiguous with the oral cavity. So there is a muscle called the palatoglossus muscle, and it's invested by mucosa, and that mucosa and muscle is going to form a fold, and we refer to that fold as the palatoglossal fold. So that is going to be the division between the oral cavity and the oropharynx. We can see that fold there. And that's roughly going to correspond to the terminal sulcus of the tongue. So the posterior third of the tongue is going to reside firmly within the oropharynx, which we can see there. As we move posteriorly, there's another muscle and fold called the palatopharyngeal fold. And in total, these are going to form arches. And between the palatoglossal and palatopharyngeal folds, we have a region of the oropharynx that we call the fauces. Fauces also means throat. And it's within the fauces here that we have a special collection of structures. Let me erase some of these so that we can see it. So the root of the tongue, so that posterior third of the tongue, is within the fauces. And covering the root of the tongue, we have the lingual tonsils. So that's the lymphatic tissue that covers the root of the tongue. Nestled between the arches, we also have tonsillar fossae, or little pits. And within those pits, we have palatine tonsils. Palatine tonsils are what we would refer to as the tonsils. So if you hear that someone is having their tonsils removed, they're typically referring to the removal of those palatine tonsils. So if you're keeping track, we've got lingual tonsils and palatine tonsils within the fauces. Posterior to the fauces, we can see some of the palatopharyngeal folds, and we can also see this little cusp here. That's the epiglottis. That's one of the cartilages of the larynx that's invested by mucosa. And superior to this, we have two little indentations. We call these the epiglottic valleculae, or vallecula singular. These are, to put it indelicately, little spit traps. So these collect saliva from the oral cavity and the fauces. And saliva could build there without triggering the deglutition or the swallowing reflex. So when deglutition occurs, the larynx is elevated, the epiglottis is slightly depressed, and materials move from the oral cavity down through the pharynx and continue on down through the esophagus with a little bit of luck. Reflex helps to close off the respiratory pathway. These epiglottic valleculae are the target for the blade of a laryngoscope, in particular a laryngoscope with a Macintosh blade. And what happens there is the blade inserts into the vallecula, and you can pull the tongue and epiglottis forward so as to view the larynx superiorly. So here is a posterior view of the pharynx with the posterior wall of the pharynx incised, open, and removed. So here we can see the pharyngoepiglottic folds, and we can see there's that epiglottis there. So that's the boundary between the oropharynx and the laryngopharynx. We can see the remainder of the larynx here. That would be anterior. It has some intrinsic laryngeal muscles associated with it, but generally there's the epiglottic cartilage there's the thyroid cartilage flanking, and then there's the cricoid cartilage. And so much of the laryngopharynx is going to be posterior to the larynx. We also have boundaries of the laryngeal inlet. That's the space through which air travels between the larynx and the laryngopharynx, as well as the inferior margin of the cricoid cartilage, which serves as the boundary between the pharynx and the esophagus, where food and beverage would continue to travel on its way down to the stomach. So the pharynx consists of a muscular wall posteriorly and laterally. Anteriorly, this is going to be contiguous, still with the nasal and oral cavity, as well as the laryngeal inlet. But we have two sets of muscles that are comprising this. The bulk of the wall is comprised of three pairs of pharyngeal constrictor muscles that nest one within the other. So here we can see that's the superior pharyngeal constrictor, there's the middle pharyngeal constrictor, and then here is the inferior pharyngeal constrictor muscles. These constrictor muscles all are going to attach to either elements of the skull or the hyoid bone or the larynx anteriorly, and posteriorly come together along a midline seam called the pharyngeal raphe. There are also three pairs of longitudinal muscles, which we can also see, and these longitudinal muscles are going to insert on different elements of the skull and soft palate and wall of the nasopharynx down to the larynx and walls of the pharynx, such that when they contract, they're going to elevate the larynx. This has the effect of shortening and widening the pharynx to accommodate the passage of food materials. Now, the innervation of this muscular wall is the pharyngeal plexus. The pharyngeal plexus, as we've discussed, has several different components to it. The majority of the pharyngeal plexus, motor, is innervated by vagus, and sensory is innervated by glossopharyngeal. In this case, because we're discussing the wall, the muscular wall of the pharynx, all of that is innervated by the vagus nerve, with the exception of the stylopharyngeus muscle. Let me erase this here so we can see it a little more clearly. So there's the stylopharyngeus muscle. That is innervated somatic motor by the glossopharyngeal nerve, which we can see has a very classic anatomical relationship to that muscle. Now, looking at these muscles through different perspectives. So here on the left, we can see the pharyngeal constrictors with the superior constrictor connecting to elements of the skull, so cranium and mandible, as well as the tongue, back to that pharyngeal raphe. The middle pharyngeal constrictor connects to the hyoid bone, which we can see right there. And the inferior pharyngeal constrictor is connecting to the larynx, so the thyroid cartilage and cricoid cartilage in particular, and then all of these to the pharyngeal raphe. So those are going to serially constrict so as to push materials through the pharynx. The longitudinal muscles tend to go deeper. We can see the three longitudinal muscles here. This is the salpingopharyngeus, which originates from the nasopharynx and inserts in the wall of the pharynx. We also have the stylopharyngeus muscle here, which runs down to the thyroid cartilage. And then finally, the palatopharyngeus muscle, which originates from the soft palate down to the wall of the pharynx. These, when they constrict, elevate the larynx, which both shorten and widen the pharynx. So the pharyngeal neural plexus, in a little greater detail, consists of several parts. There's the glossopharyngeal nerve, which we've discussed previously, that is just motor to stylopharyngeus, but is somatic sensory from the entirety of the pharynx, minus the nasopharynx. We also have the vagus nerve, which has dual duty of being somatic motor to the muscles of the pharynx, as well as visceral motor, or parasympathetic, to the mucosa of the pharynx. And then we have the superior cervical ganglion of the sympathetic chain, which is vasomotor. So that helps to constrict arteries that supply the blood to the walls of the pharynx. So this pharyngeal plexus is going to serve most of the muscles and mucosa of the pharynx, as well as most of the muscles and mucosa of the soft palate, so surrounding the oral cavity. Exceptions, as we've said before, glossopharyngeal nerve, while it's largely going to just be sensory, it has that somatic motor component for the stylopharyngeus muscle. And the pharyngeal plexus does not innervate the nasopharynx. That's going to be a pharyngeal branch of V2, which is the maxillary branch of the trigeminal nerve. And then finally, one thing that you'll probably be intimately familiar with as dental healthcare providers is going to be the gag, or the pharyngeal reflex. So you may have experienced this where, a foreign body that goes through the oral cavity and touches some of the soft tissues of the pharynx may elicit a gag. So if you've ever tried to induce vomiting because you've eaten something that you ought not to have consumed, you might try this. And so what happens is the sensory component, the glossopharyngeal nerve of the plexus, picks up this stimulus, and it sets in motion a near instantaneous and not conscious reflex where the vagus nerve contracts not just the muscles of the pharynx, but also starts to invoke help from abdominal muscles to expel any foreign bodies from the pharynx so that you don't choke on them. Now what's interesting is that this pharyngeal reflex is present in about 1/3 of the population. It's absent in about 1/3 of the population. And we have a hyperpharyngeal reflex in another 1/3 of the population. So you might find it difficult to maneuver a mirror around the division between the oral cavity and the oropharynx in those 1/3 of the population that have a hypergag reflex. That leads us to our assessment question of the video, and that is, which region of the pharynx is contiguous with the oral cavity? Is it A, the choani? Well, the choani are the border between the nasal cavity and the nasopharynx, so that's not right. Is it B, the fauces? The fauces is the part of the oral cavity, of the oropharynx, which is in contact with the oral cavity. The division is the glossopharyngeal fold, so that's a pretty good answer. Laryngopharynx, nope, that doesn't come into contact with the oral cavity. And nasopharynx, nope, that's wrong too. So the specific subdivision of the pharynx is the oropharynx, but the specific part of the oropharynx that's contiguous with the oral cavity is B, the fauces. Thank you so much for your time, and I'll see you in